Um, Thanks for being here, whether you are watching right now or are watching later on. I'm glad that you are joining. We do have the private chat or the chat feature on. So if you would like to give me any comments or questions, you are welcome to do so. There's a little lag. If you have joined us before, you're aware of that, but there's a little lag. I think it's 15 seconds. So if you type something, give me a few minutes or a few seconds to see your comment, your question, and then I'll get back to you as soon as I can. So, all right. So today we are talking about pregnancy again. I'm still pregnant, so I'm still talking about it. So what we're mostly talking about today is pregnancy symptoms. This is going to be a pretty quick video, pretty quick class. And we're just going to kind of talk down and dirty. What are my symptoms? Is this something that's normal? Is this something that I can do something for at home? Is this something that's dangerous? That kind of thing. So mostly we're just talking through symptoms that are kind of common across the board that are, obviously people have all different kinds of symptoms. There's countless symptoms that you have with pregnancy, good or bothersome. But so we're not going to touch on everything, but we're just going to kind of touch on, like I said, the ones that are pretty common that people experience. So things like nausea and fatigue and heartburn and anemia and leg cramps and those kinds of things. So thank you for being here, and we will get started. I've been talking all day, so my voice is super hoarse. So sorry if I am clearing my throat and drinking throughout the next 30 minutes or so that we're together, but just bear with me. All right, so let's talk through probably the most common thing that people ask for help with, I guess, really early on, which is nausea. So what we're going to do with each of these categories, I think a lot of people think that pregnancy should be super uncomfortable. If you are pregnant and have been pregnant and you have looked at your app, any of the apps online or on your phone that kind of guide you through, like, congratulations, you're at 14 weeks. This is what's going on in your body. And then congratulations, you're at 15 weeks. This is what's going on with your baby and you. There are so many symptoms that they talk about. I've actually had to take a couple of those apps off my phone because I like seeing them. I like seeing you are 25 weeks and your baby is the size of, a bunch of kale or whatever they are. But I've had to take a lot of the apps off, mostly just because they make me annoyed, because they just talk all the time about the negative aspects of pregnancy. And yes, it is not my favorite time of life. Some people love it. But we don't have to constantly be talking about only the negative things, saying that they're normal, saying that there's nothing we can do about them and just good luck to you. And that's what it seems like a lot of the apps, the websites, that kind of thing says, or what they say. So I want to just kind of, dispel those myths, I guess, and say, well, no, there's actually a lot that you can do for these symptoms. You don't have to just, suffer through and just try to, bear it. But there's a lot that we can do. So I'm going to be looking over here because I just kind of wrote down a quick list of things that either I or friends or people close to me have experienced during pregnancy. Okay, so nausea, we'll go with that. So is nausea normal? Or is it just common? Is it something that should be expected with pregnancy, or is it just something that many people experience? Well, I've experienced it with all three of my pregnancies, but a lot of people don't. I would say this is something that is very, very common, but it doesn't have to be normal. There's a lot of theories as to why nausea accompanies pregnancy, especially in the first trimester, but it can go through all of the trimesters. And I don't know if I've actually found a good theory that I agree with. Honestly, my current pregnancy is probably I think I've probably been the worst with my nausea. Not any longer, but during my first trimester. And I would say that I, going into pregnancy, was healthier, much healthier than I was with either of my other two. So a lot of times people are talking about, well, it's a deficiency. Oh, it's your gallbladder. It's estrogen retention. You need to make sure that you're not holding on to excess estrogen that's causing that. Any of those can be true, but I haven't found necessarily a theory that really echoed with me, so I have a hard time. However, I will say there are things that you can do for it. So there's things as simple as, and I wrote a blog post on this a little while ago, so I won't go crazy into this, but there are simple things like acupressure points, like the C-band type things that you can wear. There's the little stickers that the acupuncturists put on your ear, that either there's ones that are actual acupuncture needles, or there are ones with a little ball that you can put to help. There is a lot that you can do to help your gallbladder. So if it is a gallbladder issue with you, you can drink beet kvass regularly. We preach beet kvass here at Be Well Clinic because it is really important. It's super helpful for the gallbladder. And so if it is a gallbladder struggling, that's inducing the nausea, then you can help your gallbladder. And we'll talk more about gallbladder in a little while, but you can help it with beet kvass, by eating more fats, by there's other supplements if the beet kvass isn't cutting it, but you can use different supplements that we use here. You can use ox bile, or colocol is one that we use a lot. And then another thing that I have found to be true, well, potentially true, is that estrogen retention might be causing it. That is what my acupuncturist told me, and I always really did have good effects with acupuncture, helping at least for several days to kind of give me relief, let me relax, nourish my body again so that I could be ready for the next wave that comes on. So I would focus on gallbladder health. I'd focus on acupuncture. Chiropractic absolutely helps. And then one other thing is that estrogen retention in particular can accompany constipation because estrogen is released through, it's excreted out of the body through either feces or urine. And so if you are constipated and holding on to extra, then that might contribute to your nausea. So increasing your healthy fats that you're eating to help kind of facilitate things moving through, using bitters and good digestive support, and even enemas are safe during pregnancy. Saline enemas, anything like that can actually help just to facilitate the estrogen coming out. Okay, so since we talked a little bit about that related with bowel movements, we'll talk a little about constipation, which is super common with pregnancy. So again, there's those things that you can do that I just mentioned. So there's the increasing your fats, there's the supporting your gallbladder, there's the saline enemas, numerous other things to actually support your digestive health. The reason why kind of one of the main reasons that people think of constipation with pregnancy is that when your progesterone levels are increased, it actually slows down the motility in your GI tract. So if it's slowing down the motility, that's the movement and just kind of making everything stay a little longer. So main things to do is that we need to eat meats, right? We are all pregnant women are told to get 100 grams of protein through, every day. But muscle meats in particular are going to make it really hard to go through. Meats close to the bone of the animal are going to make it a whole lot easier for that to actually go through. So meats that are high in fat, close to the bone, increased healthy fats with like butter and ghee, and mostly animal fats. You can also use avocado, olive oil, and coconut oil. Any of those are going to help out with that. Let's see. All right, next is fatigue. So this is common or normal. I would say normal, but there's things that we can do for it. So a lot of times we're fatigued because our nutrition is actually becoming depleted, because a lot of it's going to the baby, a lot of it's being shifted around and sent to different places. So we can replenish, one of the first things is going to be water. And then replenishing B vitamins, whether it is through eggs, through supplements, or also taking liver. These are generally, there's a huge spectrum of B vitamins, right? Some of them are more calming and some of them are more stimulating. And so when we take a really good complex of these vitamins, especially in their food source, like liver or eggs, especially egg yolks, it's really going to help to kind of replenish that energy, replenish our mind, heal our minds, kind of get us back into a place of having energy. But that said, obviously rest is important, getting your sleep is important, doing what you can, and we'll talk about sleep later on. But the hydration, the rest, and then really replenishing those minerals and vitamins. Vitamins are really just kind of cofactors to help the rest of your minerals, your fats, your proteins actually work well in your body. So replenishing those are really important so that your body's actually utilizing your nutrients well. All right, we'll talk about heartburn. So common or normal. I would say normal and common. And again, if you need a differentiation, normal is it just comes along with pregnancy and that's okay. There's things that you can do. Common is things that they like to say, oh, this is just the thing that's with pregnancy. This just happens. Good luck to you. That's how I interpret it. So common and normal, we can do things to really help both of those. But you can take kind of, I guess, comfort in the ones that are normal versus simply common. Saying, yes, this is normal. This is okay. It's not a bad thing. Now here's some things that you can do for it. Okay, so heartburn, a lot of times this is because of the hormones in the body, the relaxin, the progesterone we talked about already, and then obviously just the baby. There's a baby inside. I mean, I'm 26 weeks pregnant, and the baby's big and kind of pushing up, making less room for all of the actual like digestion in the stomach to happen, so it does push up and cause heartburn. One of my favorite things that I have found for this is papaya enzymes. So if you are able to get some, I would do this over Tums or over medications, because it is just a natural way of helping your body actually digest what's in your gut so that it can move on, that you don't have that pressure pushing up against your esophagus, and everything can just kind of go the right direction, the right place. So you're actually helping your body process what's causing the heartburn rather than just kind of suppressing it. All right, brain fog and forgetfulness. Is this common or normal? I'd actually just say this is common. This does not have to be you. This can be for a variety of reasons that I would attribute basically everything to nutrition, to what you're eating. So usually this is an issue of an imbalance. So usually it goes along with too much carbs, especially if you're feeding candida. So if you have a candida issue, which is a yeast issue, and eating too many carbs can help feed that, which causes brain fog for anybody, pregnant or not. This can also be an issue with not enough fats or not enough proteins, which kind of causes that imbalance. And then also not enough B vitamins. So the B vitamins that we talked about before, through eggs, through liver, through a lot more meat animal sources, through cultured dairy, any of those kinds of things. My favorite two are the ones I keep saying, liver and eggs. So whether it's desiccated in a capsule or you're actually eating liver, the organ, and then eggs. Eggs especially have both those B vitamins, and they also have a lot of choline, which is really important for the body's attention, focus, memory, those kinds of things. So that would be, especially runny egg yolks would be my main thing to do for the brain fog, for forgetfulness kind of stuff. Since we're talking a lot about food, as far as what foods you might be deficient in, let's just talk about hunger. Hunger is a thing that is totally common and normal. This is normal in pregnancy because our bodies use up so much nutrition, so much food, whether it's the fats, the amino acids, the proteins, the sugars, the vitamins, minerals, whatever it is, our bodies use them up faster when we're pregnant because our bodies are constantly doing so much and investing so much in the baby. So if you are hungry, eat. There's so many guidelines about how much weight that you're supposed to gain in the different trimesters, in the different weeks. By this week, you should have gained however amount. I really prefer just going by what is your body telling you. And if you are hungry, eat. That doesn't mean go ahead and snack on a whole bunch of Doritos, obviously, but nutrient-dense foods, because like I said, our bodies are going to use up those nutrients way faster than normal. That's how it goes when we're taking supplements versus medications too, right? Medications have to be timed. It's only a certain amount. You can have X many milligrams twice a day. You can't overdose, anything like that. When you're taking supplements that are simply made from food, when your body uses it up, you need to take more. Your body's going to use up what it needs. And so that's exactly how it is with food. So I would not be paying attention to the weight, and this is relative. I mean, this is kind of an overarching advice from me, this that you should not be really watching so much of the weight gain, but you should be watching how nutrient dense your food is. So if you are hungry, eat nutrient dense foods, meats, fats. Carbs are entirely fine. A lot of times we give them a bad rep as long as they're properly prepared. So soaked, sprouted, fermented, any of that kind of thing. All right, let's see. Itchy skin. How does anybody have itchy skin? Especially as our bellies get bigger, this happens. A lot of times the main issue with this is if it's linked to cholestasis or gallbladder issues. We're going to talk about that in a minute. So otherwise, itchy skin, I would say, is normal. Unless it's super severe, where it probably might be attributed to your gallbladder, slapping on a whole bunch of tallow. Let's see, USF ointment, which is really thick, but unsaturated fat ointment. Anything that is edible is okay to put on your skin. So that's why I go more for the tallow versus all the numerous balms, all the different kinds of creams and lotions and stuff that you can get when you're pregnant. Because that stuff is going to probably help symptomatically. It's going to make you less itchy, but it also soaks through, goes into your bloodstream, and who knows what's in it. So anything that is edible, you can use, even vitamin E creams or tallows or different kinds of oils. All of that is fantastic for the itching. All right. While we're talking about skin, we'll go to stretch marks. So this is something that I want to say is not normal, but I'd be going against what my midwife says, and I trust her. So she says this has a lot to do with genetics. And there's a few other factors too, but we'll just go with it. Maybe this is something that is genetic, but there are a lot of things that we can do. We talk around here a lot about how we can actually change or manipulate genetics, where we don't have to let things manifest. Certain genes we can allow to express, and certain we can't, or we can cause them not to express, depending on our lifestyle, the things that we eat, the things we surround ourselves with, that kind of thing. So even if stretch marks are attributed to genes, there are things that we can do. We know certain nutrients are really good for the skin. So fat intake, like I've talked about in numerous other categories here. Vitamin D, collagen, vitamin A, vitamin C, vitamin E, and zinc. So if you think about the fat-soluble vitamins, which are A, D, E, and K, it's basically all of those. So getting a good source of fat, that is especially something like fermented cod liver oil, or just simply liver cooked up like pate or something like that, where you actually have a whole bunch of fat along with those vitamins, that would be my favorite way to go. And then adding zinc in there too. So again, the eggs, the cultured dairies, the meats, and then if necessary, supplementing with something like zinc chelate, which is one of the easier zincs to absorb. All right, let's see. Headaches. I have talked about this because this is something that I experienced a lot with my first pregnancy with having really bad headaches. And I found that it was because it was very nutrient reliant for me. So if I had a lot of carbs, didn't have a lot of fats, I automatically started having headaches. And then a lot of different neurological things that came with headaches. So that's always my go-to with increasing your fat intake. And when I say fats, again, we're talking animal fats, butter, ghee, tallow, bacon grease, lard, anything that's actually real animal fats. And then decreasing, well, we want to balance. So we don't necessarily automatically have to decrease the carb load, but we have to make sure that it's not the bulk of what our food is. Because carbs, again, are fine. There's nothing wrong with them if they are properly prepared. We just don't want them to be the bulk because we don't actually really need much of what's in those, especially grains and that kind of thing. We can get it mostly from our animal sources. All right. Another thing would be protein intake, magnesium. My favorite way to take magnesium is through an Epsom salt bath. Which again is kind of hard to do when you're, if you're busy thinking of taking a bath and taking that time. But you know what? It's super important. And if you're having a headache, you're not going to get much done anyway. So an Epsom salt bath, and then looking also at your strain on your adrenals. So are you drinking a lot of caffeinated drinks? Is there a coffee issue? Were you a big coffee drinker and then you got pregnant and you decided you had to go off cold turkey? Or have you just been so tired that you were drinking more coffee? Kind of looking at that, analyzing that, and seeing what that does to you. But in addition to that, just the fats, the proteins, and the magnesium should help a lot. All right, anemia. So this is something that I see a lot actually with patients of mine who it's actually, I would say, normal because our bodies actually do need to create a bigger blood supply for it to go to the baby and to kind of go throughout our bodies too. So it's pretty normal to become quote unquote anemic because the blood volume is so much more, so it becomes diluted. My least favorite way to get iron is through iron supplements, because those are extremely constipating and the actual absorption rate of those is extremely low. So most likely you're not getting actual usable iron. It might just be kind of going into your bloodstream. You get your blood checked and cool your irons up, but it's not actually being utilized by your body. So definitely the better source will be food. So animal sources, liver is going to be the biggest one, and then just red meats in general. So again, harping on this, you're going to see a theme, but it's super cool that during pregnancy, we don't actually have to have our 50 superfoods. We can just have kind of these key ones that really do help with all of these different areas of the body, because the body is so closely intertwined. Every body system, whether you're pregnant or not, still just needs support in different ways that'll support the whole body. So the liver, the red meats, and then making sure that you're not taking iron supplements. All right, now gallbladder problems. So we did talk about this a little bit before, but especially the cholestasis, which is where everything just kind of gets sluggish in your gallbladder. This is attributed usually to the hormones, the kind of differing hormones that are going on through your body, and it can actually be pretty dangerous. I know a lot of people who've had to get on medications, and some who've had to have gallbladder stents during pregnancy. And I mean, that's the last thing that you want to do, right? When you're pregnant, go through some kind of procedure. So ways to support your gallbladder. Like we said before, beet kvass is going to be a huge one. Beet kvass, and that's KVASS. If you're not sure of that, we have a recipe on our blog. We talk a lot about it throughout different blog posts that we have. So beet kvass, what it does is actually helps to thin the bile. So if you're having stasis or like sludginess inside the gallbladder, then it's all becoming really thick, and then it's not able to really secrete out nicely when it needs to start absorbing fats. So beet kvass is going to be a really big one to help thin that, so it's not getting really sludgy and caught up and congested in your gallbladder. Now, your gallbladder only actually secretes bile when it's told to by your body. Your body tells it to when you have enough fat in your digestive system. So if you eat fats, your body actually, the hormones connect and they tell your body, hey, there's fats in there, gallbladder, go ahead and secrete some. So if you're not taking in enough fats, your body's never going to be, your gallbladder is not going to be told to secrete that bile. So it is really important to make sure you're getting enough so that your gallbladder is actually told to do its job. Some people who have a lot of trouble with this might need to temporarily be on some kind of supplement like ox bile or some other things that we can give you here that we like, some different standard process products especially. And then the gallbladder and the liver are so closely linked. So yet again, another reason to take liver. So supporting the liver so that you can support the gallbladder. All right, we are almost done with our down and dirty on pregnancy symptoms. So hemorrhoids are the next one we're going to talk about. This can be for a variety of reasons. So a weak pelvic floor is one really big one. And if that is your case, if you have incontinence, if you've been pregnant before, incontinence of urine, anything like that, I would recommend doing pelvic floor PT, and I'd recommend actually going to a pelvic floor physical therapist. Getting your exercises, getting them to actually examine and do an assessment, all of that kind of stuff. Because that, even just pelvic floor PT can help you reduce your hemorrhoids, which would be fantastic during pregnancy because you want to have those under control by the time you're ready to give birth. Other things that you can do are cell salts. So cell salts are some of my favorite things. I think they're so cool. It's basically different really elemental kinds of salts that make up our whole body, and there's 12 of them. There's certain ones that are very specific for hemorrhoids, and I don't have my little paper here that has the exact names, but it's a super easy Google search. There's only 12 of them, and cell salts for hemorrhoids, those can actually really help a lot. It's a homeopathic type thing, totally safe to take during pregnancy, because again, it's just made up of these elemental mineral salts that make up our bodies. So just supporting our bodies with extra ones is really helpful with that. And then it's really well known that hemorrhoids are actually really closely linked with gallbladder issues and liver issues. So yet again, all the same things that we talked about with the gallbladder and the liver, that is same stuff we want to do to support hemorrhoids. So again, super easy. We can just take a couple really key foods or supplements if necessary for a little bit of time to help support so many different areas, including hemorrhoids. And then lastly, one thing that I think is super cool is plantain. So plantain is a plant. Right now it is probably a little late for plantain season, but it is generally a weed that just grows throughout where I am in Colorado. As long as it's in a place where they don't spray, herbicides or whatever for broadleaf, chemicals for broadleaf plants. You can find plantain, and you can look it up. Plantain, just like the kind of banana-ish kind of thing, but it's different. Those leaves, if you crush them up, they're actually really anti-inflammatory, and they help with hemorrhoids in particular. So you can crush them up, mix them with a little bit of water, and just put them on topically, and that can be really soothing and actually helping to get the hemorrhoids to no longer be irritated or external if they are. Okay, and then lastly, I want to talk about pelvic pressure. So pelvic pressure, totally normal, right? I mean, this is obvious. There's a baby in our bodies. It is pushing down on our pelvis. There is pressure. So there's a couple things that I would recommend for this, because at different times, this has been a struggle for me. And then I know, oh man, I'm not doing XYZ. So pelvic floor PT, to bring that up again, is extremely helpful with this. And I've gone to pelvic floor PT several, after each of my pregnancies. and then even during this pregnancy. And I've noticed that when I don't do the exercises for several days in a row, or probably more than that, but maybe a couple weeks, I kind of forget and I feel good and I'm fine. I'll start feeling a lot more of that pressure. And then even just a couple days of doing those exercises again will help out with that pelvic pressure. So again, I really recommend doing pelvic floor PT even during pregnancy. A lot of times people think about it about after for the postpartum time, but even during is really helpful. Chiropractic, extremely helpful. I go once a week right now to my chiropractor, who is right downstairs from me at Kindred Chiropractic. It has made a world of a difference for sure when I started getting on like a really steady, consistent routine with that. Helps to relieve a lot of the sciatic type stuff, the pressure, and just kind of make sure that what is tight can be almost like massaged out, and just things are kind of in the right spot. So I would recommend chiropractic as well. And then my last favorite thing that I just recently started using, thanks to Dr. Courtney, my chiropractor, is kinesiology tape. So this I've been using, and she told me that belly bands, that kind of thing, while maybe okay for very temporary, just for a couple hours at a time, something like that, they actually can really restrict the baby. And that's the last thing we want to do. We're not trying to restrict the baby's growth, or, you know, that where they, the room they have to grow and move around. So kinesiology tape actually just helps to support. You can put it, if you just look online for, you can like do a search kinesiology tape during pregnancy, and you'll see so many different things. So I usually take it and put it kind of around my belly. I won't show my actual belly button here. So kind of around here, and then another one that goes a little straighter across to go underneath. Let's see, this is backwards. So kind of around like a U, and then more straight across. That has helped me so much. And that stuff, this tape stays on for anywhere from 3 to 5 days. You can shower, bathe with it. Really, really helpful for any kind of like back strain with the weight, and with the actual weight of the belly on your pelvis. So I would recommend that also. All right, I know that was super quick. That was just like a down and dirty rundown. I will not always be talking about pregnancy, but it seems to just be the theme nowadays, for obvious reasons for me, and because I have a lot of pregnant people coming to me now. So I would, let me know. Let me look through chat and see if there was anything that came up here. And if you have any questions, feel free to let me know. I'll give it just a little bit of time, because like I said, there's like a 15-second lag. So you're welcome to add that in, and I'll just hang out for a little bit. We are having a class in 2 weeks. Amy will be doing our next class. We also in October have a live fermenting class that Amy will be doing at the Loveland office. We have a lot going on around here. So make sure, if you're not on our newsletter and you'd like to be, because we do really have a lot going on, go ahead to bewellclinic.net, and it should be in the description on YouTube. And go ahead and sign up for our newsletter, because we'd love for you to join us. That's how we're doing most of our communication versus social media nowadays, just because we want to be able to say what we want to say, and just kind of have our freedom on our site. So and through emails and stuff. So join us over there. We are still on social media, so you are welcome to join us on there as well, and let us know what questions you have or how we can help you out. So, all right. Thank you for joining, everybody who jumped on. I appreciate you being here tonight. And I will see you all next time. Have a good night.